Good afternoon, everybody. Thank you. I first want to thank Amit, Mugda, and Frankie, and the entire Liveweek team for organizing a great conference. It's always great to be in New York because I'm reminded of how fast-paced everything is. But it's a more serious reminder in the context of the Sustainable Development Goals. It means we don't have too much time. There is no time to waste. Every minute counts. So once upon a time, I was a vibrant athlete. I won several 100-meter sprints. Some races I came in second or third. But I remember with every race, the intention was to give it my best. I also enjoyed playing netball, and I had amazing 6 teammates. And the power of collective intention was the binding pillar of whether we won as many games in a semester or not. As a team, our collective intention to win and individual intention to collaborate was what won us several games. So where am I going with all this talk about sports and collaboration and intention? While the SDGs are definitely not sports, we can still apply 2 key binding pillars, and those are intention and collaboration, if indeed we are to achieve or come close as possible in meeting the 2030 SDG agenda. There are 17 SDGs, as you can see. There are 169 targets, 230 indicators, and a whole spectrum of players, from agencies of the United Nations, your bilateral agencies, foundations, NGOs, universities, consulting firms, all the way to the last CSO. Obviously, the SDG team is nothing like a netball team of only 7 people, but we, the global health community, can still win. The success of the first 16 SDGs that you saw really depends on SDG 17, which is partnerships for the goals, where the intention to solve some of the world's pressing challenges and intention to collaborate must be clear from all angles and all actors. As I stated, there are several SDG actors involved, but I would like to highlight the role of grassroots organizations, their critical role in narrowing the gaps at the community level, and opportunities to collaborate and partner in order to achieve the SDGs. There are many wonderful grassroots organizations impacting lives, transforming communities, and contributing to the SDG 2030 agenda. We've heard from some of them yesterday and also today. One another example is Childbirth Survival International. Childbirth Survival International, also known as CSI, is a global grassroots organization with 5 interconnected priorities, all dedicated to improve reproductive, maternal, newborn, child, and adolescent health in marginalized communities. CSI is a member of the World Health Organization Partnership for Maternal, Newborn, Child Health, is a member of the White Ribbon Alliance for Safe Motherhood, and collaborates with governments, local and international partners across sectors. We are currently in 5 sub-Saharan African countries, and the vision is to keep expanding within the continent and also to other developing countries where there's a huge need. And our programs focus on the vulnerable and the marginalized, women, newborns, children under 5 years old, adolescents, and the youth. Just like the way you see that tree, CSI is intentional. If we want to achieve the SDGs or anything in life, one has to be intentional about it. CSI's work is strategically centered at the grassroots and on mothers, women, and girls, with a continuum approach in community-based health programs and health services, because we know significant gains are made for families, communities, and countries when we invest at that level and target at-risk and vulnerable populations. The social status of women and children, especially girls, is a key factor for many sustainable development goals, whether it's ending poverty, improving health, reducing food insecurity, accessing quality education, or promoting peace and social justice. Women and girls cannot be left behind in the SDG 2030 formula. In reaching the unreached with health services and information, CSI collaborates with local partners, communities, and implements evidence-based programs, plus interventions to save lives, reduce burden of disease and disabilities, improve health literacy levels, and empower individuals to live healthy and productive lives. This simple graphic depicts the importance of strengthening public health interventions and efforts at the community level with the community. You have the highest burden of disease and disability at the community level, with inadequate care, skills, information, treatment options, and various resources to provide quality primary health services, such as antenatal care, family planning, cervical cancer screening, just your basic healthcare package. A lot of emphasis is often placed on population-level health. However, the challenge is it always doesn't trickle down to the last person in the remotest community. As CSI, we recognize in many of these communities there's high poverty, low literacy levels, limited access to opportunities, and culture is intricately woven in their day-to-day living. Hence, we are intentional by applying several cultural lenses in the work that we do to influence positive health-seeking behaviors and make an impact at the community level, especially for women and girls. Former First Lady of the United States, Michelle Obama, said it best. Communities and countries, and ultimately the world, are only as strong as the health of their women. It's important for us to focus at the community level in order to achieve some of the SDGs. With that, I'd like to segue and share more about CSI's grassroots work and contributions to the SDGs. We provide childbirth kits. I brought a sample if anybody's interested to take a look at it. It's a childbirth kit that contains all the basic medical supplies that pregnant women need to go deliver. We give them to the women so that we're empowering them to go deliver in a health facility with a skilled birth attendant. We train nurses and midwives on the content of those kits, and the kit only costs $7. To date, we have provided them to 400 women in 2 African countries, and more needs to be done. And those are some of the pictures. When we provide these kits, we also provide additional services such as family planning, HIV testing, STI screening, and health literacy to empower women. We're very much based in the grassroots. We go out to different communities, rotating within districts, rotating within regions. And here is a video of a nurse, a nursing officer in Uganda who talks about CSI's role in helping save lives in Uganda.
From Uganda, partnering with CSI in the USA, we are too appreciative for your partnership and for the great work you are doing for women of Uganda, especially today when you have come and supplied them with mama kits. Really a great job. And we thank you for being part of reducing maternal mortality and morbidity in Uganda. Keep up that part. Thank you.
Okay. So that is CSI in Uganda. We provide free cervical cancer screening using acetic acid and treating women that test with positive precancerous lesions with cryotherapy. And to date, we have been able to screen over 400 women. We're currently just doing this in Uganda. We are promoting cervical cancer prevention by increasing access to the HPV vaccine for young girls and working with families and communities to understand the benefits of why the girl child needs to be vaccinated with HPV vaccine. Women with advanced cervical cancer, like I mentioned before, those we cannot treat, we refer them to the National Hospital by providing them transportation to get quality care. And those are some of our pictures. We focus on prevention, screening, testing, and of course we collect data to ensure that the information, we're able to use that in order to share with donors and partners and even the government in terms of how effective some of these programs are at the grassroots. We educate and empower women and girls through different programs, but most importantly, the Youth Scholarship Program that focuses on those children who have dropped out of school at a very young age. And we've been able to sponsor this year at least 3 girls who will be graduating at the end of the year. They're acquiring life skills. They're pursuing their dreams and living their full potential. But the beauty of it, they're now giving back to their families and their communities. We're also supporting women to be able to start their own businesses at home. For example, poultry farming or goat farming. We're doing that at the community in order to empower women so that when they're economically empowered, they're able to afford basic necessities such as food for their families. They're able to afford they're able to afford health services within their communities. They're able to improve their social status within their own communities. And we have the program known as Girl to Girl Power that has impacted 4,000 girls in 2 countries, again, Tanzania and Uganda, with basic information on menstrual health, menstrual hygiene, providing them with sanitary pads, empowering them to go to school and stay in school longer. Because when we have girls in school, the achievements are much greater for the families and communities. And with this, as you realize, the other achievements kind of focused on SDG number 3, but this particular one kind of looks at more of the SDGs and the impact that they have. And here are some of the pictures of the work that we're doing. And with that, I just want to say thank you so much. As we keep on working, we hope that more people will be able to support some of our initiatives at the grassroots. Thank you.